Medicine is very confusing now. The system that we've adopted in this country is to treat after the fact. And what we're trying to do is prevent chronic ailment from happening. That's what we do in this office. What we try to do is listen to the patient, get a clear, succinct clinical history, and then try to attack that trigger. So when something was wrong, we try the pills. If the pills don't work, we take it out. This type of medicine is called integrative medicine, meaning you put the conservative routine medicine, we combine it with this type of medicine, root cause, that's where the power comes in. Cancer is a perfect example. You need in some instances chemotherapy and radiation to kill the cancer cells. The problem is they destroy the cancer cells and they also destroy every single normal cell in your body. Oftentimes, the number one complaint that I hear from patients is the doctor doesn't have time to see 60 patients a day. I get 10 minutes. There is no way on hell that you're gonna fix somebody's problems in 10 minutes. It's just not gonna happen. We care, one, at least I do, from the heart. We listen to the patient's concern and we give you options, following which you make a decision as to what to do. We have some cutting-edge equipment in this office that very few places have. And I explain to patients what those modalities are each for and what they should expect. We do the total body pure scan, which works on thermal energy from your hands and your feet. That's what feeds the computer what is wrong with you. So it will likely identify if you're inflamed, how much inflammation you have, and where the inflammation is located. Keeping in mind that disease and inflammation go hand in hand, and that inflammation always goes to the weakest link in your body. We do a 14 tubes of blood, 23-page lab report with every single organ that you can think of from A through Z identifiable. Things like hormones, allergies, methylation, metabolic deficiencies, testing for Alzheimer's, testing for genetics, and so on and so forth, which is not only comprehensive by itself, but I will sit down with that patient on a one-to-one basis for an hour, sometimes more, so that we can go systematically through every single test which was done. Subsequent to that, we custom tailor a program for their individual needs. Again, the equipment we have in this office is cutting edge. It involves ozone, hyperbaric, infrared, cold plunge, red light, lasers, and so on and so forth. Critically important to optimize the patient's health. Once the patient goes through the customary 3-month physician-supervised handheld program, then we enroll the patient in a maintenance program, so that you continue to enjoy the benefits of your 90-day experience into the future.